I invite you to partake on an exciting educational journey related to public health theory, practice, and research. You shall discover on this learning adventure that the art and science of public health is inter and multidisciplinary in nature, very complex and broad, and is continuously evolving over time. Lecture 5, Understanding the Concept of Health, Its Evolution, and Definitions. Before we begin, take a piece of paper and try to jot down a few thoughts regarding these questions. Firstly, how would you define health? Secondly, can an individual living with a chronic communicable disease, such as HIV/AIDS, hepatitis B, truly be healthy? Why or why not? And thirdly, can an individual living with a non-communicable disease, such as cancer, diabetes, bipolar disorder, or dementia, truly be healthy? Why or why not? Although we are prepared to spend huge sums of resources and money on health, no one really seems quite sure what this concept actually is per se. It may be argued that health is in fact a ubiquitous and dynamic term with diverse interpretations and meanings to individuals in diverse cultures, and it often varies across the lifespan. Indeed, you ask a small child what it means to be healthy, and maybe they will respond that their tummy doesn't hurt or they don't have a sore throat. Whereas ask someone who is 85 years old what it means to be healthy, and for them it might be socializing with their friends. In fact, there is currently no single universally utilized or accepted definition of health. Health as a process or journey. In fact, it may be argued that health is not a single state, goal, or destination, but a process that involves various interconnected and interdependent factors and dynamic states of existence across our entire lifespan. Hence, health is not a single linear destination, but a dynamic and complex interactive journey through one's physical, biochemical, social, political, cultural, and spiritual environments. Archaeological evidence reveals that wild grains were in fact cultivated and eaten from at least 20,000 B.C.E. Pigs and sheep were domesticated in Mesopotamian era around 11,000 B.C.E. The establishment of settled and permanent communities first occurred during the Neolithic period of about during the 8th or so millennium BCE in the Near East, and then it subsequently spread to northern parts of Europe during the 4th millennium BCE. During these periods of time, both men and women in these early societies functioned as caregivers, who were often trained priests, priestesses, shamans, and or so-called witch doctor. Hence, worship of nature became a logical vehicle upon which these early agricultural societies based their healing practices, mythologies, and their religious practices. The belief in evil spirits, angry gods or deities as the root cause of all ill health and disease first emerged during this period. In this photo, you see a replica of an ancient Viking or Norse temple with various deities based on powerful animals and nature. And I took this picture in Denmark. Here's an example of a demon curing mask from Sri Lanka, Asia, which was carried during special rituals performed to please the demon gods and cure the sick for villagers. This mask represents the sickness demon and his 8 servant demons that each represent a different kind of disease. Here we see a photo of a trepanned male skull from Northern Europe that I shot. There is evidence of healing, in fact, for these 2 holes, so this male individual actually survived. Interestingly, evidence of this practice has been found in prehistoric human remains from Neolithic times dating from about 6500 B.C.E. and onwards. Trepanation, in other words, boring into the skull with various instruments, was carried out on clients deemed insane or behaving abnormally to let out evil spirits or demons. Ancient Greece had a rich culture and mythology comprised of various gods of the earth and the underworld, and special healing agents including snakes, ants, and various symbols. For example, the sun god, who was named Apollo, was both the god of health and medicine. The Greek philosopher and scientist Aristotle, who lived from 384 to 322 BCE, had a profound influence on healthcare and medicine in Greece and abroad. And he also laid down the foundations for biology and comparative anatomy. Another famous Greek was Hippocrates of Cos. And Hippocrates is regarded as the father of modern empirical or rational medicine. In fact, he was the first to formally dismiss the belief that disease or states of ill health resulted from angry spirits, demons, or deities, but in fact resulted as a consequence of a break in the laws of nature that could be investigated. Hippocrates was the first to employ case histories to describe various ailments, clinical treatment outcomes, and of course complications associated with various diseases in a collective work entitled Epidemics. The 4-body humors theory held that 4 different bodily fluids or humors influenced human health, and they had to be in perfect balance. Otherwise, a person would become either physically or mentally ill. For example, a respiratory or lung problem resulted when there was too much phlegm in the body. Hence, the body's natural reaction was to rid itself of this excess amounts of phlegm by coughing it up. Hippocrates argued that each humor was also linked to a specific body organ, a season, a temper, either hot or cold or warm or dry, and an element such as earth, water, air, or fire associated with alchemy during the time and later on. An imbalance could result, for example, from inhaling or absorbing vapors such as a swamp gas. To restore the right balance, a physician might therefore recommend consuming special medicines, a diet, getting an enema, undergoing a phlebotomy to get rid of excess blood, or the application of leeches. It is interesting to note that Hippocrates' theory of disease causation actually lasted a remarkable 2,000 years after its inception and was widely taught throughout Europe and elsewhere. It was only subsequently replaced by the germ theory of disease causation during the 19th century, which we shall examine in greater detail shortly. Natural causes of disease and cure directive of medicine established. This is a critical milestone in the evolution of our understanding of health and its definition based on natural causes as opposed to those associated with supernatural forces that could not be controlled or manipulated by mortal man. Hence, the foci of medicine changed from preventing disease and states of ill health to a cure directive. The Renaissance period, 1453 CE to 1600 CE. This period is characterized by the movement away from scholasticism towards revived scientific learning and realism. Here's a photo, for example, that I shot in Bologna, Italy, for a dissection table where students would gather around and the professor would dissect a corpse, a cadaver, and expose the various body organs and so forth. Renaissance medicine was in fact marked with an increase in anatomical knowledge, aided by the easing of the legal and cultural restrictions for dissecting cadavers. This period is also marked by various distinguished scholars and scientists, including Copernicus, Da Vinci, Galileo, and Vesalius, to name but a few. Leonardo da Vinci was a 15th century artist, architect, engineer, cartographer, and anatomist, and he is credited with various inventions and discoveries, including the parachute, the helicopter and tank. He was also the first to correctly identify the normal curvature of the human spine and to dissect and draw a fetus in the womb. This remains a critical milestone in the evolution of the concept of health. It is noteworthy that Leonardo da Vinci was the first to describe the human body as a beautiful living machine in which all the components or parts were interconnected but were capable of being separated and studied in isolation. This remains a critical milestone in our evolution of the concept of health because it served as the foundation for the mechanistic medical model of health. The mechanistic medical model of health. So here we have Leonardo da Vinci, who comprehends the human body as an engineered biological contraption or apparatus that is similar to a robot nowadays. Health based on this model was achieved when all the biological or machine components, if you wish, or parts of the body functioned properly. Hence, the mechanistic medical model of health is based on the notion that the individual is deemed healthy providing they are disease-free and that each body system or component is functioning optimally and properly. This model for health has resulted in the establishment of a variety of specialized fields in medicine and specialized hospital units or wards that cater to these specific body systems over time. For example, the cardiologist will treat the malfunctioning heart. The nephrologist treats the malfunctioning kidneys. The hepatologist treat the malfunctioning liver, and of course psychiatrists will treat the malfunctioning mind. This model and the way that we set up current acute care hospitals continues to dominate our publicly funded healthcare systems in Canada and abroad. For example, funding schemes for the Canada Health Act, which was passed by Parliament back in 1982, is largely based on episodic and hospital-based acute care, dominated and driven by physicians as gatekeepers to these healthcare services and diagnostic procedures. The mechanistic model of health, here each body system or part is deemed separate from the others and therefore requires isolated or unique treatments and specialists to deal with them. However, we now know, based on the best available evidence, that a malfunction in one organ can affect different organs as well. For example, let us consider heart failure, which is often treated by cardiologists. Well, heart failure, in fact, can result in arrhythmias of the heart, but it can also affect the gastrointestinal system, resulting in hepatic congestion or dysfunction. As well, heart failure can also affect one's respiratory system, resulting in pulmonary congestion. Hence, we need to really rethink our definition of health based on this mechanistic medical model of health and look at individuals from a holistic perspective. The 18th and 19th centuries are characterized by various technological and scientific discoveries. For example, Louis Pasteur in France discovered how viruses were attenuated. He also developed an effective treatment for rabies and discovered the process of pasteurization to kill harmful bacteria present in raw milk, along with Claude Bernard. He also confirmed the germ theory of disease causation. Similarly, during this period of time, other noted individuals include Robert Koch, who discovered the tubicil bacillus as the cause of tuberculosis, or TB for short, and the cholera bacillus in 1883. Joseph Lister, who lived from 1827 to 1912, he really revolutionized surgery by decreasing the incidence of post-operative infections through the use of a mild carbolic acid solution sprayed during surgical procedures. Here you see a conceptual diagram of the unicausal laboratory-based model of disease origin and cure. The continued predominant directive of current medical research for finding the specific causes and cures of disease, or so-called magic bullet approach, has remained an enduring consequence of the unicausal laboratory-based medical model of health. For example, in Canada, we have the CIBC Run for the Cure for Cancer that takes place every year. We're not trying to prevent cancer or raise money for prevention, but to find the cure. We have literally spent billions, if not trillions of dollars, trying to find a so-called cure for heart disease, for cancer, for diabetes mellitus, bipolar disorder, and dementia, and other non-communicable diseases. To no avail. In fact, we now know that these diseases are often caused by a variety of causes or etiologies, including one's lifestyle, their lifestyle factors such as diet, smoking, inactivity, and various social determinants of health, such as poverty, one's educational level, access to healthcare services, to name but a few. In 1948, the World Health Organization came out with this new definition of health, comprised of both physical, social, and mental elements. And the World Health Organization defined health as such. Health is not merely the absence of disease or infirmity, but a state of complete physical, mental, and social well-being. Well, the WHO definition, 1948 WHO definition of health, of course, was highly criticized for various reasons, including its utopian vision that is really unattainable ideal in the real world by many individuals across the lifespan. It also unintentionally contributed to the medicalization or control of society and individuals by physicians and other healthcare professionals and providers. This definition of health as a complete well-being is in fact no longer relevant or meaningful for purpose, given the rise of NCDs, or non-communicable diseases, globally. The Lalonde report is a critical milestone for our understanding of the concept of health because it was the first official recognition by a developed nation, in this case Canada, globally to formally recognize the link between health and a variety of social determinants of health based on the best available scientific evidence to date from a variety of disciplines and fields of research, not just medicine. The Lalonde report identified 4 broad determinants of health: human biology, environment, lifestyle, and healthcare organizations. This was a critical milestone because we now viewed health from a holistic perspective, which directly challenged the outdated medical model of health. Here we see a conceptual diagram of the Lalonde's 4 original determinants of health: human biology, lifestyle, healthcare organizations, and environment. So let's examine each of these concepts in more detail. Human biology. Human biology comprises of both physical and mental elements, according to Lalonde's definition. The environment comprised of all elements related to health that were regarded as being external to one's body. For example, the use of pesticides are currently known hazards, especially to developing infants in utero and young children, with both known acute and chronic toxic effects, including respiratory problems, skin reactions, neurological and developmental issues, all the way to cancer. Contaminated water supplies is also a major public health issue. There are a variety of waterborne diseases such as cholera, dysentery, typhoid fever, that can cause illness and death in literally millions of people each year. Here you see also a photo of a squatter's home I shot in Hong Kong. We know that poverty is a major social determinant of health, linked to ill health, various diseases, decreased quality of life, and increased morbidity and mortality. Lifestyle comprises of elements which an individual has control over, such as being physically active, and self-imposed behaviors, such as smoking and alcohol consumption. More than 4 out of 5 adults aged 35 years and older in Canada are currently inactive, and this number jumps to over 83% for those over the age of 50, as reported by the Public Health Agency of Canada. Moreover, an estimated 33%, or 1/3, of 5 to 11-year-olds in Canada are in fact obese and overweight. This is alarming. Similarly, 25% of Canadians aged 15 or older, or 1 in 4, are overweight or obese. And these have all been associated with various development of various non-communicable diseases, such as heart disease and cancer. Healthcare organizations consist of access to healthcare services by all citizens within a given community, irregardless of their income or ability to pay for these services. These could be acute care services, such as those in hospitals, or receiving preventative services from public health nurses or from pharmacists, such as getting one's annual flu shot, or perhaps hospice services, which provide palliative services for end-of-life care. The Alma-Ata Conference, 1978. The Lalonde report was viewed as a futuristic and groundbreaking evidence-informed document by many nations around the world at this conference. Moreover, Lalonde's new definition of health and emphasis on health promotion across the lifespan was also embraced by the World Health Organizations and many nations also. This is a critical milestone from a public health perspective because health promotion activities, as opposed to the cure directive of the mechanistic medical model of health, emphasizes holistic perspectives and interventions to promote, maintain, or restore health and well-being across the entire lifespan. The Ottawa Charter for Health Promotion, 1986. At this Ottawa conference, delegates revised and updated their definition of health by incorporating a social ecological component that recognizes the intractable links between an individual and their environment where they live, work, and play. So here you see some fisher persons in Hong Kong harbor that I shot. We know that gainful employment is a critical social determinant of health. Moreover, we have to engage in sustainable forms of fishing to protect our water resources. The Ottawa Charter for Health Promotion identified 5 broad strategies for global health promotion. First, to build healthy public policies. Number 2, create supportive environments. 3, strengthen community actions. 4, develop personal skills. And lastly, number 5, to reorientate health services. New global definition of health. This 1986 WHO International Conference was also instrumental in reinforcing the idea that the medical model of health and the delivery of healthcare services based on this model was outdated and inadequate to address current healthcare challenges and needs facing diverse populations across the lifespan. Health was now defined as the ability to identify and to realize aspirations, to satisfy needs, and to change or cope with the environment. Health is therefore a resource for everyday life, not the objective of living. Health is a positive concept, emphasizing social and personal resources, as well as physical capabilities. You can see the word disease or infirmity are no longer present in our understanding of the concept of health, interestingly enough. In addition, let's examine the concept of mental health. Simply stated, there can be no health without mental health. Mental health is intrinsically indispensable and a critical component of health and well-being of individuals, families, and entire communities. The Public Health Agency of Canada defines mental health as the capacity of each and all of us to feel, think, and act in ways that enhance our ability to enjoy life and deal with the challenges we face, and a positive sense of emotional and spiritual well-being that respects the importance of culture, equity, social justice, interconnections, and personal dignity. The World Health Organization definition of mental health is a state of well-being in which every individual realizes his or her potential. They can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her or his community. This concept of mental health embraces promotion of mental health well-being, the prevention and treatment, as well as rehabilitation of individuals affected with mental illness and disorders. Promoting mental health, here are a few personal examples. What I do to promote my own mental health: I enjoy building furniture, which you see on the upper left-hand corner here. Here is a kitchen trolley that I built. I also made all the cabinets there in my kitchen. I enjoy carpentry. There below it you see a colonial style bed, queen size bed that I built. I also enjoy engaging in water sports, anything above the water or below the water, with my two teenage sons. I also enjoy traveling, and one of my hobbies is to write music and compose music. You see the Devil's Triangle album. That's one of my albums. I now have 2 albums out there, so I enjoy writing and composing rock and roll music. So if you have an opportunity, check it out. It's called The Rockin' Prof is my YouTube website for this. The social determinants of mental health. The Mental Health Commission of Canada reports there are 3 essential social determinants of mental health that are important from a Canadian context and experience. And these are, number 1, freedom from discrimination and violence, having social inclusion, and access to economic resources. Here's a suggested additional reading that you may be interested in. This chapter explores the understanding of our concept of health, its evolutions and definitions in greater detail. from a historical context? Well, that's all, folks. I just want to thank you, and I hope that you listen to other lectures in this mini lecture series related to the art and science of public health. Cheers!